Welcome to Series 1 of Managing Anxiety During the COVID-19 Pandemic. My name is Rob Cipriano. I'm a board-certified police and public safety psychologist, and I'm also an advisory board member for Cortico. I'm a Florida licensed and North Carolina licensed psychologist, and I'm also a member of the International Associations for Chief of Police Psychology Services section, and I'm a current member of Division 18, Psychologist in Public Service of the American Psychological Association. In Series 1, we're going to talk about anxiety, and we're going to talk about anxiety from three particular areas and three particular perspectives. Number one is physiological reactions. Number two will be behavioral, and number three are psychological. I'm going to break each one of them down, and I also include for you a little bit of a mime for each particular reaction that you could follow along in the PowerPoint. So we first look at physiological reactions. It includes body reactions such as rapid heartbeat, muscle tension, queasiness, dry mouth, sweating, things that generally just start happening. We may not have a rhyme or reason why they start getting activated, because generally there's a trigger for those. The second one is behavioral, to where that person can be sabotaged and that person is struggling to think, act, express, or cope with everyday situations. So the person generally gets kind of pulled in by those thoughts and emotions and now starts actually displaying some behaviors that are not comfortable for that person. They are blanking out. They're feeling like they're not able to actually complete the task at hand, and they're wondering, where did this come from? That's generally, no rhyme or reason sometimes. And then the third one is psychological reactions of what we tell ourselves. So it could be a subjective state of apprehension and uneasiness. So when I talk about three of these areas, really what I'm talking to you about is a simple phrase that I've used for a long time. Thoughts become words, words become actions. So the thoughts that we have and that we possess are a window to our mind. If we could work on those thoughts and become what I call a best detective of those thoughts, then we could change those thoughts to where we can control emotions and we can control our behaviors. So I'm going to be speaking to you a little bit about those things, as you follow along with today's training. So when we look at three levels of recovery, we're looking at reducing physiological reactivity. So those items that I've mentioned to you about the sweatiness or the rapid heartbeat or maybe having some challenges with catching our breath to where, that's happening overtly that we're aware of, or it's happening inadvertently. It's just kind of happening, right? So we're gonna work a little bit on our breathing. So generally what I try to do to help people is let them know to breathe in 3 to 5 through their nose and breathe out staggered 7 to 9 out through their mouth. And trying to kind of maintain a sequence of that from anywhere from, say, 3 to 5 to 6 minutes. The second one, what we talk about is eliminating avoidance behavior. So with eliminating avoidance behavior, what we're really trying to do is stop avoiding, right? So it's kind of a double negative, but that's important during this situation. Not to be flooded with doing things that we're uncomfortable with, but kind of doing it in a very systematic fashion, very slow-like fashion. The third piece is changing subjective interpretations or self-talk or self-dialogue, which can fuel a state of apprehension and worry for us. So those three areas of recovery are very, very important here in Series 1. When we look at anxiety, it can appear in many different forms, different levels of intensity, duration, and frequency. And what I've also included for you are below of particular disorders in this manual that we use called the Diagnostic Statistical Manual version 5. And there are a cluster of these, but they all have some things that parallel or some things that are in common. So number one, maybe panic disorder, where the individual is actually having more of the physiological reactions that I just mentioned and is having difficulty actually identifying where they're coming from, when they may happen, and how long they may last. Which, again, going back to the breathing issues, the challenges with concentration, the heart palpitations, the sweatiness, things of that nature. When we look at phobias, really what we're looking at is we're looking at avoiding. So when I talked to you a little while ago about an individual that's avoiding behavior, right, that actually can become self-reinforcing in itself. So that's not good, because the more that we avoid, the more that we feel safe. So avoiding over long periods of time can now start very, very slowly leading into a phobia, which is I'm going to avoid that particular setting, or I'm going to avoid that particular situation because it makes me feel safe. The third one is obsessive compulsive types of traits and disorder. And for those, generally what we're looking at is two areas. We're looking at behaviors, but we're also looking at thoughts. So thoughts and behaviors. An example in this situation is I didn't clean enough, or I didn't wash my hands enough in this situation, so therefore now I need to do more. So the person starts developing into a ritualistic behavior. But what makes it a disorder is looking at those three areas: intensity, duration, frequency, and then adding three more. Does it affect me socially, occupationally, or legally? And any of those would be on the check mark. The two others are acute stress reactions or acute stress disorder and post-traumatic stress disorder. Acute stress disorder is no different than post-traumatic stress disorder, with the exception of time frame. So the time frame being, with PTSD, generally within 30 days, but also beyond 30 days, where the symptoms tend to wax and wane. So they're kind of on and off, and they can actually happen with different levels of intensity, duration, and frequency. And again, some of those clusters, it takes an outside event to trigger that. So in this COVID situation, that would be the outside event that could activate it, right? So now the person now starts having some additional symptoms: intrusive memories, flashbacks, nightmares, difficulty controlling their level of reaction. So you may see more irritability, avoidance behavior, and unfortunately sometimes substance abuse. With acute stress disorder, almost the same carbon copy of symptoms, but generally happens within the 30 days and generally dissipates right up to the 30 days and does not resurge. And then the last one is what we call a generalized anxiety disorder, where the person is pre-wired for some type of anxiety, and that may intensify certainly during this COVID situation, and is very easily hyper aroused and vigilant as well. So what we're looking at here is we're looking at signs of stress from COVID that can also look like not just COVID, but certainly the stress, and the stress being chest tightness and feeling like you can't breathe, muscle tension, aches and pains, headaches, difficulty sleeping, restlessness and inability to relax, heart palpitations, digestive issues, and those things tend to intensify over time. Scanning for threats is very, very important during this COVID situation. So again, going back to that phrase that I mentioned to you, being your own best detective of your thoughts, to where our thoughts may be triggered by the environment of what we fear, consciously or subconsciously. So being able to scan for those threats and being able to kind of control those thoughts through some items that we're going to be talking about of how to reframe or change them in future series of our training is going to be very, very key. Scanning for threats is often associated with our minds assigning meaning to things that may not necessarily be harmful to us, right? But we feel that they're harmful, and they now kind of take on a life form of their own. So what also starts happening is this physiology of this fight or flight, what I call fight, flight, or freeze. And when our anxiety is naturally up, that fight or flight can actually really, really kind of tend to get more and more heightened in everyday situations unless we're using some management tools. Over time, these are generally adaptive, meaning they're very healthy for us, but when they're used and abused because of the stressor or the lack of management tools that we have, meaning controlling our thought processes, they can become kind of out of control and haywire, if you will, and what we call that is maladaptive. So that's generally some of the biology that happens when, something like an outside event like COVID also now triggers the mental health, behavioral health side of that fight or flight type of response. And also, like I mentioned, including freezing. Catastrophizing is another particular thought process that happens where somebody goes from 0 to 60 very, very quickly. So the person goes in a classic example would be I'm having difficulty breathing, or maybe I'm sneezing, or maybe I'm running into, some type of physical reaction. I'm going to be on a ventilator. I'm going to end up dying. That would be an example of catastrophizing, to where now we're already dealing with the outside event of the COVID, but now that person is internalizing and going from 0 to 60 with their thought processes. And those thoughts act as a string of beats. Think of thought 1, and then now kind of continuing, almost unfortunately like a runaway train, to thought 40 in a matter of maybe a minute. Thought 40 is going to have a lot more weight to it as a metaphor that can pull that person in, and then that person starts catastrophizing. Another area that's important here in Series 1 is understanding the difference between expectations versus goals. Expectations are generally based upon shoulds, woulds, coulds, haves, always, must, never. Goals are based on, again, that self-dialogue that we keep talking about. Person developing a phrase such as, I'm working on it, I'm in the process of, hey, let's see what happens. I don't need to necessarily worry about the extreme, right? I can kind of take things one time at a step, or one time at a time, right? So the person is generally kind of looking at it, not looking too far in advance, but is really, really basing their mindset on their phrase in their mind, controlling their thought process, and not using absolute words like I mentioned in the expectation realm. So a very simplistic way of remembering that: expectations equate to the word outcome, goals equate to the word process and hope. Okay? So I think that's a big part of what will help you, throughout this process. And in conclusion, there's one more piece for Series 1 that I want to talk with you about, is what we call reasoning from emotions. So reasoning from emotions is where the individual feels a certain feeling / thought and says to themselves, this is true, without any merit, without anything that can validate or substantiate it, right? So if I'm feeling a certain way, it must be true. And because it must be true, now this is what's going to happen. So reasoning from emotions can be very, very detrimental in a situation like this. And it's important to kind of recognize it early on so we can actually do something about it. So that's it for Series 1. We're going to move on to Series 2. And as we move on to Series 2, that's going to be very, very key. So Series 2, welcome. I'm going to talk with you about reality-based management tools during the COVID-19 pandemic. So these are very reality-based circumstances, predominantly given to us by the CDC here in 2020. The vast majority of people only experience relatively mild symptoms. Coronavirus is fatal in about 2 to 3% of cases, from what the CDC is telling us. Health advice for the public is as follows: that we are encouraged to wash our hands with warm water and soap for at least 20 seconds after coughing or sneezing, before and during, after we prepare any type of food, before eating, after using the restroom, and certainly even before using the restroom might be an important factor. When we get in from outside into inside settings, when our hands are visibly dirty, and when caring for the elderly or those that are ill. After handling any of our pets or taking care of our pets in any way, especially if they use the outside area, cleaning any type of waste or any type of debris, it's important to wash our hands. Using alcohol-based hand sanitizers as a substitute for washing our hands, but doing so certainly sparingly and following CDC guidelines. Maintaining a safe distance of at least 2 meters or 6 feet between ourselves and certainly anyone that's coughing or sneezing. Wearing a protective mask out in public is certainly recommended. Covering our coughs and sneezes and throwing our tissues into a closed bin after usage. Avoiding touching our eyes, our nose, our mouth, and frequently disinfecting surfaces like our desk, our phone, our tablet, our smartphone, and our countertops. And again, that will conclude our Series 2 as we're going to be moving into Series 3. So thank you. Series 3, welcome. The benefits of relaxation. So I want to talk with you again with the benefits of relaxation that include regular daily practice of deep relaxation skills, To counteract the effects from stress or anxiety, that may include decreasing in heart rate, decreasing in respiration, decreasing in blood pressure, decreasing in skeletal muscle tension, decreasing in metabolic rate and oxygen consumption, and also decreasing in our analytical thinking and increasing in our skin responses. These are all benefits. And like I was talking to you about in series 1, breathing in 3 to 5 seconds and breathing out 7 to 8, 7 to 9 seconds, almost in that staggered response, can really help that fight or flight type of response and also that freeze response. We also call that sympathetic and parasympathetic, right? So we're really kind of regulating the blood flow when we breathe in, really breathing a lot of oxygen and stimulating that blood flow to most of our internal organs here in our abdomen. And then when we breathe out, kind of releasing that to where we're feeling that nice kind of pattern where we're feeling blood flow kind of going back to our extremities and continuing with that volley. So relaxation is very, very key. I like to couple up relaxation with some visual imagery. Talking to you about that in series 3 here. The visual imagery could be a place of peace, serenity, a place that's very, very relaxing for you that maybe you've been to when you were younger, as a young adult, as an older adult, but a place that gives you a lot of respite in your mind, tranquility, peace, and most importantly, safety. So a lot of times you can couple up and use those skill sets with the breathing, but also the visual imagery. Self-talk is very, very important, and I mentioned that in series 1 of having, and really looking at the negative self-talk that can add to already an existing anxiety-based response. So with the COVID situation, we have the external event that now we have a particular interpretation of what that event is, and then subsequent to that, there's now feelings and reactions and behaviors that can result. So again, going back to that phrase that I mentioned to you, thoughts become words, words become actions. Very, very key. If we can manage our thought process and that interpretation of what this event is, it may not turn into those catastrophic thoughts that may have been fueling a lot of that anxiety, or certainly reasoning from emotion types of thoughts that I had mentioned to you, to where, again, you are your own best detective. So what we try to do is we try to regulate what ifs. Just like I mentioned to you in some of the previous series about shoulds, woulds, coulds, haves, always, must, never, we also want to regulate what ifs. What if I panic? What if something goes wrong? What if I can't handle it? So what I generally try to recommend to people is to kind of write those thoughts down, whether you're putting them in your phone, whether you're writing them in a journal, and then you start challenging them. You start reframing them very gently and eliminating the what ifs, eliminating the shoulds, woulds, coulds, always, must, haves, to, and nevers. So we're really shifting that and really working on that goal focus, which is, let's see what happens. I'm working on it. I'm hopeful. Who knows? There might be actually a pleasant surprise from this, learning some new skill sets. So those are things that can really, really be game changers in this COVID-19 situation. So as I conclude this particular series, I want to encourage more self-supportive statements that reinforces our ability to cope as opposed to the what ifs, okay? And again, in conclusion, I want to thank you and look forward to seeing you at the next series. Series 4, welcome. So with Series 4, I want to talk with you a little bit about our self-talk and just really kind of build upon Series 3. And with Series 4, I want you to look at a few different questions. When I talk to you about that negative self-talk, especially what ifs, shoulds, woulds, coulds, always, must, have, tos, and nevers. So we want to look at a phrase. What is the evidence for this, right? So during this COVID situation, what is the evidence for this, for me to be thinking a certain way and for me to be feeling and behaving a certain way? Is this always true? Has this been true within the past? What are the odds of this really happening or being true? And what is the very worst that could happen? And am I looking at the whole picture? Very, very important as far as that self-dialogue. So when we look at these 6 particular questions, what we're really trying to do is we're trying to reframe those initial thoughts that we may have had in previous series, and we're looking at what those thoughts are, and those thoughts can actually pull us into this situation. So one of the things that I try to do and I try to recommend is to really, really regulate what those thoughts are. So I call those thoughts automatic negative thoughts. When we look at eliminating them, we want to look at the clusters, right? So not just the 6 questions, but actually identifying what these clusters are. So number 1 is what I call the inflated negative outcome. So the inflated negative outcome is very similar to the catastrophic thought, but becomes a little bit more global and a little bit more magnified in the sense that if I do this, then this might not work or this may happen. And you start really kind of getting into a sense to where you start feeling trapped. We don't want to do that. The catastrophic thoughts, like I've mentioned earlier in one of the series, is the catastrophic thoughts to where the person goes from 0 to 60 very, very, very quickly. So if I have a cough, now I'm going to be on a ventilator and now I'm going to be dead. Okay? So that's where that person starts kind of catastrophizing in their mind, if you will. Underestimation of coping ability to where the person feels that they don't have the necessary coping skills to power through and to work through this particular period of time. Distorted thinking can fall into several clusters, and just to kind of recap, overgeneralizing. So the overgeneralizing is where it's a one for all, and maybe I made a mistake, maybe I didn't wash my hands enough, and now I've exposed everybody. So therefore, I made the mistake, I am a mistake. And then really beating yourself up, in that type of situation metaphorically. Mention the should statements, shoulds, woulds, coulds. We want to really avoid those, but those are very common to actually write down, to be aware that we're doing that so we can actually change that. And then again, that emotional reasoning, I feel useless, therefore I am useless. So the person generally kind of really tags themselves, with a one and done, if you will. When we look at all of these in these clusters, it's really, really important here in Series 4 as we conclude to not only recognize them, but actually now kind of change the framework of our mindset with some of those previous suggestions. I want to thank you again for having the opportunity to work with you here in Series 4 and look forward to seeing you in Series 5. Welcome with Series 5 as we start focusing and concluding with our series here. We want to look at some evidence-based protective factors that contribute to resilience. And some of those items are, number 1, optimism, effective problem solving, faith, sense of meaning, self-efficacy, or also effectiveness of how effective we are with using some of these skill sets as we've discussed. Flexibility, but not just being flexible behaviorally, but being thought flexible, right? How are we able to actually make that adaptation and that change with our thinking, right? And are we not only being flexible, but are we adapting to the situation, right? Are we at a point where we're not just kind of like cemented and just kind of like, very rigid, but, we're able to kind of adapt and be a little bit spontaneous and try something else and seeing how we feel, think, and behave thereafter. Impulse control, when we get frustrated, are we lashing out verbally? Are we shutting down? So we're able to kind of control our impulses during this COVID-19 situation to where, again, it's going to be for the better. Empathy, close relationships with people, such as family and spirituality, are very, very important as far as evidence-based protective factors in developing resiliency. And resiliency, what we want to look at is resiliency is the ability to bounce back in the face of adversity. Very, very key, very, very important in a situation, and generally kind of yields and happens as a result of being in very stressful situations, over a period of time. Some additional helpful tools as I conclude our series, and this again being Series 5, is creating a sense of routine and structure each day during the quarantine. Limiting the breaking news reports of just, the tragedies that are happening, and really, really kind of focusing on just keeping a particular time frame for that from an awareness standpoint, from an educational standpoint, and not getting interfused with thoughts and emotions where it pulls us in to where now we start jumping into some of those previous aspects that I mentioned in some of the earlier series of catastrophic thinking, reasoning from emotions, and things of that nature. Involving oneself in self-help independent hobbies within the home, what types of activities you can get involved in. Very, very important, especially if it's something that's going to be pro-social and helpful for you down the road. Completing one house project at a time and not keeping, 2 or 3 projects to where it's starting to become stressful and troublesome for people. Self-stimulatory games such as puzzles, crosswords, solitaire games, or activities with family who are also self-quarantined, and certainly adhering to those CDC guidelines of making sure that there's all of the factors that the CDC has recommended with social distance and testing and things of that nature. So there's nobody at risk if we're going to be self-quarantining in the same household. Those are really, really important pieces. Again, here in Series 5, I want to thank you for the opportunity to serve you as first responders, and thank you. And I wish you very much happiness this year, success in your endeavors, and thank you again.